Audiology SLP Talk with Sunil and Sruthi. This is the first YouTube channel dedicated for audiology and speech language pathology in India.
We thought of coming up with this YouTube channel because now everybody uses a smartphone and YouTube is something which everybody gets easy access to go through. So we thought we will come up with some ideas, some current trends in the field of audiology and speech language pathology, where we'll try to update you with the current trends which are happening in audiology and speech language pathology. So that will be in the form of different kinds of video. Here we are going to make sure that you will definitely have a piece of information which is fruitful to you all.
We'll be covering updates on latest articles, news, as well as few case studies which is interesting and few simple clinical tips.
In our videos, we are also going to review the new hearing aid which is launched or a new diagnostic instrument which is launched, which will definitely help you in having updated knowledge about that particular instrument in your clinical practice. In our videos, we are also going to discuss and demonstrate the useful speech and language-based material and evidence-based therapy techniques by the help of professionals who are actually using it in their clinical practice.
You will be getting updates on upcoming seminars, workshop, conferences so that you don't miss them out in your decision.
In our every video, we will try to give you a gist of vacancies available for all those who are seeking a career opportunity as an audiologist and speech language pathologist.
Last but not the least, we are planning to show you in our later sessions how different academic institutes and clinical setups work in India. It doesn't matter where you are, you will get an opportunity to see and understand different aspects of professional life.
So first one is one of the prestigious and biggest national level conference, that is ISHACON. ISHACON 2017 is going to be held in Kolkata. Going to ISHACON is always a super exciting and it's an opportunity to learn a lot. Also, you can meet your fellow colleagues. The dates for the ISHACON are 6th, 7th and 8th of January 2017. Pre-con for this ISHACON 2017 is on 5th of January 2017. The best part of pre-con this year is that the pre-con is going to be held in association with ASHA. So do make sure that you attend pre-con as well as ISHACON 2017. So you will have to hurry up for the paper submission because the last date of paper submission for the ISHACON 2017 is 30th of September.
There is one more interesting workshop. This is on vestibular assessment. It's a CRE program and it has got RCA credits. It is organized by Patil University, School of Audiology and Speech Language Pathology, Pune. This is where I work currently. It's a 5 days program starting from 27th September to 31st. This is going to be a really good opportunity for those who are planning to incorporate vestibular assessment in your clinical practice, as to learn vestibular assessment better through clinical and practical demonstration. This is for all cochlear implant lovers. CIGICON 2016 is coming up on 7th, 8th and 9th October 2016. It is in Kochi, Kerala. Are you interested in cleft lip and palate? Then be ready to pack your bags to Chennai. There is 13th International Congress on Cleft Lip and Palate and related craniofacial anomalies. It is from 8th to 11th February 2017. We have a lot of time to prepare for it.
Are you bored with traveling and spending more money on learning? Then don't worry. ISHA is coming up with a new idea, that is live webinars. It is an effort made by ISHA to make learning more digitalized, cost effective and simpler. The coming webinar from ISHA is on 1st of October from 2 p.m. to 4 p.m. The topic of coming webinar is assessment of speech perception in Indian adults and children. So make sure you register for that webinar and do watch that webinar. So it's time for the clinical tip for this video. This clinical tip is about malingering. At some times, you might be coming across a cases who is complaining of hearing loss only in one ear, that is a unilateral hearing loss. So it's very easy to catch a patient complaining of severe to profound hearing loss, that bilateral. It becomes easy for clinician to catch them using their behavioral observation, at the same time doing a pure-tone audiometry. But there are some cases who can be a malingering case, and that too they are complaining that they are hearing only through one ear and other ear might have a problem. So in such cases, it becomes difficult for the clinician to test the unilateral hearing loss. So for such patients who are complaining of unilateral hearing loss, you can administer a Stranger's test. Stranger's test might be an additional test for you to do, but it will save you a lot of time by over-referring a patient to ABR. It might cost you a very few minutes of your time, but definitely it will be an easy test to administer to identify a patient with malingering in only one ear. So it's time for giving you current trends happening in the field.
We have now got hybrid cochlear implant system. MEDEL, Medical Electronics, which is an Austria-based cochlear implant company, has got FDA approval for its SYNCHRONY EAS hearing implant system, which can be used for ski slope hearing loss patients who are 18 years and above. One more news from cochlear implant. Advanced Bionics has released its new cochlear implant, that is High-Res Ultra CI, which is the thinnest profile from AD. According to them, it has the fastest stimulation rate, wide input dynamic range, as well as 120 bands, which will help in a better music perception as well as getting a natural sound quality.
So next news is from a hearing aid company, that is Phonak. Phonak has now come up with a rechargeable battery hearing aid. Phonak is using a lithium-ion battery to their hearing aids, which is a just rechargeable battery. Now, a patient need not to fumble with replacing the disposable batteries again and again. This is a very good news for the patient as well as audiologist. Now, next news is related to speech-language pathology.
A study has proven a new treatment possibilities for treating Alzheimer's disease. A team led by Dr. David from Manchester University have found that anti-inflammatory drug has completely reversed the memory loss and the brain inflammation in mice. So this is not proven in human beings, however it's a kind of hope that this may lead to new treatment options in Alzheimer's disease. According to them, this is the first time a drug is being found for treating the inflammatory pathway. So we can have some hopes that there will be future new treatment options for Alzheimer's disease.
In this section, we are going to show you the recent articles which are published in different journals, which we found interesting and clinically useful. If you find these articles interesting, then to know more, you can check the description box given below.
First, we will present you an audiology related article. This article is published in International Journal of Audiology in this month by these authors. The topic is Functional Hearing in the Classroom, Assisted Listening Devices for Students with Hearing Impairment in Mainstream School Setting. In this article, they have tried to assess the benefit of ALD for students with hearing impairment in mainstream school. Speech and noise was assessed in typical classroom setup along with teacher-student listening inventory for education revised questionnaire to check the improvement from baseline. So they have reported that the use of remote microphone, that is Roger pen, and the sound field system was really helpful for these students. The functional hearing advantage was noted by both teacher and student when remote microphone was used along with a standard device. So what you have to understand from this, if you have a school-going child with hearing impairment in your clinic, always remember to recommend them remote microphone along with a standard hearing device. I have found it in my patient that there is a definite advantage of remote microphone in a typically noisy classroom setup. I understand it's a very costly affair, however, we should not forget to give an useful option for the patient. Not only this article, There are many other previously published articles which discuss about the use of ALD in school children. So start recommending your pediatric cases with HI for ALDs. Second article is from Speech Language Pathology. As you can see on the screen, it's a recently released article from JSHLR related to stuttering. The title is A Brief Version of Unhelpful Thoughts and Beliefs About Stuttering Scales, the UTPS 6. UTPS is a scale of comprehensive measure of unhelpful cognitions associated with social anxiety in stuttering. They have a full version of UTBS and they have tried to make a brief version of UTBS which can be used as a screening instrument. This study says that the brief version of UTBS is an efficient and reliable tool and it gives valuable clinical information about whether a patient has to be referred for psychological assessment or not. If the total score is in and above the 5th decile, then it is recommended to refer the patient for psychological assessment as per this article. So to know more about the article, you can access the link below given in the description box.
This is just the beginning. We are planning to come up with new ideas to keep you updated. Keep watching and support us by sharing your ideas and suggestions, and also let us know if we are missing on any information. It's time to wrap up our first session. We might have missed out a few information, so you can add on to our video by sharing your knowledge, your information about your event or job vacancies or anything which you feel that it should be shared through these videos. It can be mailed to our email ID.
Our email ID is audiologyslptalk@gmail.com. Thank you for watching our first video of Audiology SLP Talk with Sunil and Shruthi. If you are hardcore and enthusiastic to SLP, then please share, subscribe and comment on our video. We would like to have your comments in our comment sections below. So please make sure that you share this video with your friends and colleagues.
So see you next time. Keep learning and be young. Bye.